For Ms. Shields, participants in your program had a choice to enter into these plans. Is that correct?
That's correct. They would do their research to determine if our plan fit them best or if they wanted to go to the ACA or anywhere else.
And what they experienced was lower premiums and deductibles in this option.
That's correct. They had better prices, lower deductibles, and as pointed out earlier, it may not be necessarily that the price was lower, but they had a better plan that fit their needs.
And so what you're saying is that they were satisfied with their access to the care through these programs?
Absolutely, especially the fact that they were able to come in. We covered the previous existing conditions that they had, or that they were able to keep their doctors, or for whatever the necessary reason was.
So what I'm hearing is that this is a choice that these individuals are choosing. They were potentially able to get lower premiums and deductibles, and they were satisfied with the care that they were receiving.
100%. Our whole point was to offer it as a benefit so that they had options, because many of them, again, were not insured and didn't feel that they had anywhere that they could get the insurance that they needed.
So when you see that pattern, it is astounding that people would be opposed to giving people a choice to get lower cost health care that they are satisfied with. That is astounding to me, that somebody would go on the record and say, I want to take away choice from people to get low cost health care that meets their needs. I'll just leave it right there. So the next thing is I want to talk to Ms. Strauss and ask about small businesses, a particularly challenging environment for healthcare in our economy today is making sure that small businesses can offer affordable healthcare to their individuals. Can you tell me about additional innovative options that you're seeing in this space that meet those needs?
Yeah, so we routinely talk about the level funded, which is the self-funded plans in that small group market with most of our groups. So there's a little bit more flexibility in that. However, there are things coming into the market around direct primary care that actually, again, puts those employees in the driver's seat. So we have a program that we can offer to employers at a minimum, just a minimal fee on a monthly basis, and employees have direct access to a provider team that they can call, text, email at any time. This team not only advocates for them in situations where maybe a claim has been denied, which agents do all the time, and I just had one of those this week, so sometimes those denied claims are lack of documentation that needs to just be put together. But when we look at these things, the whole experience, which I think Mr. DeSaulnier had mentioned, the quality of care is very challenging. A lot of times somebody might get diagnosed with something and just accessing the next step is very difficult. When you have these advocacy programs in place, you actually have a team that is not only helping you to navigate that process, a lot of times they have success in getting appointments sooner for these people. They have the ability to look at prescriptions, and so they can look at a wide variety of prescriptions in case somebody got prescribed something that's very expensive or not covered. They can do that medical management with them. And they also just have a little bit more of a person in their corner. So they know that they can contact this provider team, and that team already knows them. They know their family members, and they don't have to take the time out to go to a doctor that they might only see for 15 minutes to then be sent to a specialist or when just out into the healthcare system. And so again, these are providing that really high level of touch to the employees, and it is bringing the claims costs down because these programs do not run then through the insurance program. So for these basic needs that they have, those claims don't run through. And so when you partner that with a level funded plan or a high deductible health plan, the out-of-pocket costs go down significantly for those members that are participating in that.
Great. Well, thank you for sharing that with me. What I would like to close on is that we know we have a broken healthcare system in this country. I think everybody up here agrees with that. So the question is, where do you go next? And for me, the clear answer is that we want people to innovate. We want new options, more options available for these individuals. It could be association health plans. It could be self-insurance. It could be telehealth. It could be direct primary care. It could be anything that we are not even aware of at this time. But the way that we are going to get those solutions is by getting government out of the way. instead of having a one-size-fits-all approach, which is failing people in many instances, I think we need to allow the free market to innovate, allow these new options to come online, and they can work in tandem with things like Medicare. It's not, or Medicaid. It is not a one-size-fits-all option. I think we need an all-of-the-above solution here. And so I, again, thank you for your testimony today and these new alternatives that you have presented that I think we should be in support of. Thank you, and I yield back.
The gentleman yields, and now recognize Mr. Sonnier, our ranking member, for his questions for 5 minutes.
Thank you, Mr. Chairman. I hope we're still friends. And the comment